This is not a glamorous disease. It kills you slowly and agonizingly ravaging your lungs. It stops you breathing. It causes you to cough up blood, and your friends and family avoid you because this disease is contagious. It doesn't require the mosquito factor of malaria or dengue, nor does it require the sexual intimacy of HIV/AIDS. All it takes is a cough and millions of infectious droplet release, and all of you could be infected. This disease is actually the perfect assassin. Yes, you probably figure out by now the disease that I refer is tuberculosis or TB. But did you aware this disease has infected millions of people and caused of thousands deaths in our country? And for every hour that we are spending now, 11 people die from TB. You didn't hear of those deaths. Perhaps it didn't matter. But bear in mind, you, your friends or your family may be surrounded by this disease and may also be infected and suffer from tuberculosis. In Indonesia, TB exists on an epic scale. It's our most serious public health problem to this day. The burden cost of recovering from TB has reached 1.2 million rupiahs. And unfortunately, if the patients develop a condition called drug-resistant TB, which means the drugs are no longer effective, the burden cost will be more than 100 million rupiahs. Something that poor countries cannot afford. So, what's the issue? According to data from the Indonesian Ministry of Health, 9 out of 10 of TB patients are still undetected and show no signs or symptoms. And it becomes a huge problem because those people who are not detected will infect those around them, increasing the transmission of this disease, having poor health outcomes, and their families will suffer from economic distress. Our current Minister of Health, Mr. Budi Sadikin, even stated that 52% of people with TB in Indonesia remain undetected to this day. Consider how bad that is. And exacerbated by the level of knowledge in our society, which is still low at 49%. As a result, promotion and prevention approaches are critical to be implemented in Indonesia. To all the honorable audience, I'm Nasim Amar, representative of Universitas Brawijaya, would like to emphasize the importance of promotion and prevention approaches in Indonesia to support our government to achieve the target of SDGs number 3, good health and well-being. Ladies and gentlemen, are you aware that our society's mindset on health has been dictated to focus on treating disease rather than preventing it? Yes, that is exactly what is happening right now in Indonesia. Today, about 95% of the budget of the government spent on health is focused on treatment and care, while less than 5% on health prevention issues and promotion. It is not surprising that we have TB, dengue, or malaria where there has been a failure for basic sanitation or healthcare that may prevented them. It is not surprising that individuals over-consuming salty foods and are unable to receive adequate blood pressure treatment, leading to stroke. It is not surprising that people are unaware of the need of quitting smoking and suffer from lung cancer and finally die. It is also not surprising that elderly with frailty die as a result of the nutrition system failures. I believe we need to rethink our approach to health prevention and promotion focus. We can start by adopting a healthy lifestyle to reduce vulnerability. Secondly, we can encourage the healthcare and the government to play a more active role, including providing routine screening programs to determine disease risk factors, giving education on the effects and impacts of smoking, physical inactivity, unhealthy diets, and excessive alcohol consumption, as well as giving more counseling on healthy lifestyles and vaccination. Through these approaches, we are not only overcoming infectious disease such as tuberculosis, but also several big killer diseases such as heart disease, cancer, diabetes, and lung disease. We can enhance the health of millions of people while saving vast amounts of money and meeting the SDGs aim of good health and well-being by 2030. Let us be wise and focus on preventing rather than treating. Thank you.